Concerns over teenage pregnancies as more than 145 teenage mothers gave birth on Christmas alone countrywide. The youngest mother to have given birth on Christmas is a 16-year-old. Now, KwaZulu-Natal is among the provinces that recorded high number of teenage pregnancies on Christmas. For more on the story, I'm now joined by Dr Siyabong Nzimande, a KZN Children Sector. Thank you so much for your time this afternoon, Doctor. What do you believe are the underlying factors contributing to the high number of teenagers giving birth, especially in the KZN region?
Thank you so much, Katlego, and greetings to you and your viewers. I think for me, number one, it is concerning that we are thinking about this as if it's something new every year. Every time when it's December or when it's around Christmas time and New Year's, we look at the number of deaths and we look at our politicians visiting the hospitals, and then we get to document that this is alarming. But what is really the underlying factor here is that it's happening throughout the year, and the strategies that we are enforcing currently, they may need a little bit of meaningful stakeholder engagement. It's the Department of Health, it's the Department of Social Development, it's law or maybe human rights movements to look at how do we end child pregnancy and how do we end teenage pregnancy. In driving these programs, we need to be specific in actually asking ourselves, are we consulting young people enough? If you look at our goal to end AIDS by 2030, we are saying that young people are a priority population. If we are saying that young people are a priority population, what is it that we are doing to consult with young people, not just to call them when we're seeing a high number, but we are looking at programs here that are supposed to be for young people, by young people, led by young people. We should allow communities to lead the strategy, and government maybe might need to stop thinking that it's all about getting T-shirts and branding, putting up a marquee, and we're doing a campaign on this. It goes beyond just campaigning. It's the program. It's the behavioral change. It's the policies and the commitments that government have made around these issues, also not just domestically, but also internationally. And we need to look at how do we revise these programs to speak meaningfully into our communities.
So, Dr. Nzimande, you obviously are saying this is a scourge faced by these young teenagers throughout the year. We are heightened to it when our politicians are visiting them during the times of Christmas and New Year's Eve. But what are the challenges that are faced by these teenagers throughout the year in terms of their education, their healthcare, and their overall well-being?
Thank you so much for that question. One of the most fundamental tool that we have in South Africa right now is the comprehensive sexuality education curriculum development. It was well researched, but it is not well implemented. When we begin the process of implementation, meaningfully keeping girls in schools, but also not just focusing on young girls, but also focusing on boys, and also ensuring that those who are the custodians of this comprehensive sexuality education, they are actually comfortable enough to take this content into a young person and measure if is it able to benefit this young person, then the numbers will drop. Then we'll look at these are really our priority populations. We are driven by data, and we're able to crowd out child pregnancy as well as teenage pregnancy in our province. If you look at KwaZulu-Natal, it's a different community everywhere. It's the rural community, it's the peri-urban community, it's the urban community. What's the communication strategy? How much of that communication strategy into these programs that are supposed to help young people is influenced by young people? And who's measuring that communication strategy? Or we are just saying, you look at these messages that are driven by our MEC in KwaZulu-Natal, that iskuni siyabayizisa. That's a good language, but who is it talking to? Some other young people may not even find relevance into that. Let's go back to the basics of ensuring meaningful engagement with our young people.
And obviously that engagement, as you refer to, is in the preventative measures that need to be taken in order for these young people not to be having babies at such a young age. But with those who are already within the system of being mothers, what support systems are in place to assist these young parents in South Africa as well as in KZN?
If you look at South Africa, we've got a beautiful program, which is your AYP program. Before that, we had a She Conquers program, but because of the mere fact that we're saying She Conquers, we're talking to a girl child. We're leaving out the boy child. We went back to the drawing board, and I'm still underlining the meaningful engagement of these young people. When we went back to the drawing board, now South Africa has a new strategy, which is Zikhala Kanjani. In that strategy of Zikhala Kanjani, there are a lot of programs that are being implemented and coordinated within each province to look at the coordination strategy. But it still lacks those young people. Solution that we know is the poverty issue. It's how we're not looking at this as if it's not a legal issue. We're looking at this as if it's a programmatic and behavioral issue. When are we going to enforce law and human right that the statutory rape here, a 14-year-old delivering a child, we need to get an NPA report that tells us that this person has been prosecuted. There was somebody who was brought to account. Where young people are exploring, they are both 14 years, the boy is 14 and the girl is 14. There should be programs. Like if you look at social development programs that are talking about YOLO, you only live once, or there's also CHOMI, which is for below the age of 12 years. How do we make sure that these programs are integrated with economical strengthening as well? How do we make sure that we're not just talking at behavior alone, we're not just looking at HIV prevention alone, and we're not going to really buy it as some society to say we're going to put every young person on preventative treatment for HIV and only on contraceptives without digging deeper into their family structures. Social development itself has come up with them research that told us that many of these young people that are pregnant, almost 80%, are coming from structures where there's no family unit. Who's restoring the family unit? So we still need a multiple stakeholder approach that is going to be looking at all other stakeholders within South Africa. KZN need to do that same thing. Those who are coordinating need to begin to coordinate rightfully. At the moment, you don't see the coordination. Programs are there, but the coordination is still lacking.
I mean, Doctor, you speak of the issue of statutory rape. I mean, with what you're seeing in the KZN, what are the gender disparities in the teenage parenthood rates? Are we seeing that more of the mothers are teenagers and the fathers are much older when it comes to the issue of statutory rape?
In before cases, we're seeing a lot of those where it's a young person and there's an older male involved. And of course, we speak against that. We want to see the law taking its place. But the new norm that we are beginning to see when we analyze the data, it's young people from the same age group. Therefore, now we are speaking about sexual exploring. We're saying young people are exploring. But if we have enforced the proper education measures in place and we've brought accountability into these programs, we would have seen a certain level of justice beginning to take place and also numbers beginning to be reduced. Our numbers are extremely high. If you look at eThekwini alone, they had about, in a period of 3 months, there was about 26,000 pregnancies and about 1,254 between the period of December and April last year. And you looked at, out of those were below the ages of 14. We need then with those to enforce, to say behind these numbers, there are faces, and the faces were violated. It's a human right violation that you have a 14-year-old delivering a child. Mm-hmm. Where is the action in that regard? It needs to be taken.
Speaking of action, Doctor, is there a responsibility on the healthcare professionals who help deliver these children? So if you help a 14-year-old give birth, is there responsibility on your end to report that there is a possible case of statutory rape?
It should. In terms of health and the statutory rape guidelines, it should be reported. And that's the accountability that we need to see. We need those numbers from government itself to begin to tell us, out of this number of children that fell pregnant, there's been prosecution, there's been reported cases, and we need to ensure that the reporting happens in a speedingly time, other than just putting data there in beautiful graphs, but not really putting the narrative behind that data. And as civil society in KwaZulu-Natal, this is when we're pushing for government to say, in our next provincial AIDS council or council on AIDS, these are the structures we use to bring government to account to say, stop it with your fancy graph, stop it with all of your numbers that you are reporting to us, give us the narrative behind. And we're beginning to see change. However, we need to look at what are we investing in when we're speaking about the funding. The donor agencies need to play the right card now. Money should not be coming to one big organization. We need the money of prevention of these pregnancies to be seen in the community, and data must drive where we are also placing these services. I read the article on the 26th where the MEC, Nomokuku Smelane, says that young people must also be made aware that there are services to prevent pregnancies and it's available at the facility. We don't want to see facilities anymore. We want to see health at the door. Health must knock at my door. And then we can speak about, are we able to measure that change? What is it that is stopping young people to even go to healthcare facilities? When do they present to healthcare facilities? It's something that we also need to begin to question.
Lastly, Doc, what role does cultural practice and the responsibility of parents? Because surely there's only so much that government can do in preventing young people from falling pregnant. But with you as a parent, you know when your child is not home at certain times or did not spend the night at home, and that could open red flags in terms of what possibly could come at the end of the day. We do know that some cultural practices, especially in the province of the KZN, has previously averted young girls from falling pregnant. Of course, the responsibility doesn't only fall on the girls. What roles do those play, and how much of awareness and communication are we putting on the parents themselves as well as those cultural practices in assisting in this scourge?
I think our government has done tremendously well. I have to applaud them in that regard, including the Premier's Office of KwaZulu-Natal, where they are able to look at priority districts and look at, if we are saying Umkanyagude is the priority district, Uchukela, where there's also Uguchwala, which is the cultural practice. And look, there was research that was done within Utugela district, and there were programs that were designed within Utugela district to look at how do we look at cultural practices versus this adolescent and teenage pregnancy problem. And we got the data that is telling us what needs to be done, but then we lack in the implementation. But at the same time, I want to stress this. It's not just government responsibility alone. It's not just civil society alone. And again, I'm saying this to stand to be corrected, because as the research tells us that these young people come from broken families. So sometimes you find that there's not much role of parenting. So it might have to go back to say it takes a village to raise a child. The fact that I'm a child-headed or there's no one other supervision, where's the neighbor? Where's the village? Where's the community around this? So we still need that parental involvement to be strengthened, and we need programs that are going to be measured to look at how do we ensure that. Last but not least on that point, keeping girls in school. We know that it works. UNAIDS has showed us a number of times within their program, which is Education Plus, that it's not just education alone that is going to keep this girl not pregnant, but it's education and other programs and other community stakeholders. The policing forum need to play a role. The feeding scheme need to play a role. The ward councillor must play a role. So we're looking at really, we got the pathway to get there, but at the same time, we're not utilizing enough resources within each community to end this adolescent and teenage pregnancy.
All right, Dr. Nzimande, thank you so much. We really appreciate your time this afternoon. A very sensitive and touching issue when it comes to young girls falling pregnant across the country.